Great to be back here again, folks. And it is the Pittsburgh Weekend Edition. Hashtag the Mohsin program. Feel free to reach out to us, 1-800-662-9550. Every month we have a nonprofit on, and it's valuable to us. It's empowering, it provides education. And this weekend, special shout out to Alan Levine for his recovery. I know he just went through surgery with his kidney transplant. And so we're really celebrating with having the National Kidney Foundation here. We have both Jenny and Erin from the foundation. How are you?
Great.
Wonderful.
Thank you for having us.
Oh, no, it's a real pleasure. It's an honor. Because life-changing work, and there's certain areas that, a lot of areas people don't know. I was doing my reading, and so I'm going to just give you the time to just share, okay? So tell me a little bit about the National Kidney Foundation.
Yeah, we are the leading organization in the United States for the awareness, prevention, and treatment of kidney disease. We work on many levels. We work with patients, families, healthcare providers. We also work at the government level. We do advocacy work to change public policy. We offer a number of programs and services within our local communities. We have 26 offices across the country. We're a national organization.
And we're here in Pittsburgh, and a lot of viewers and listeners, I'm sure, maybe don't know that we're here in Pittsburgh. And like Jenny said, we are a national health organization, the national health organization dedicated to the awareness, prevention, and treatment of kidney disease. And we're one of 26 offices across the country on the front lines, ensuring better outcomes for the 37 million Americans who are affected and impacted by this disease. Nationally, we have 225 dedicated staff members on the front lines, like I said, working very hard to serve the needs of the community. If anybody is interested, like I said, we are in Pittsburgh. We're right on the south side, near the Cheesecake Factory, and we love to have people come and visit us. So you can always check out our website at kidney.org as well.
Perfect. So when you raise funds, where does the money go?
So where does the money go? We, like I said, we do lots of events and programming, and they can't be done without each other. And so 82 cents of every dollar that we raise at our events, and we can touch base on what those events are locally, directly go to our programs, our education, and our research initiatives. And by that's a very high number of cents to go back
very
into
much
the
so,
community.
actually. I'm very surprised.
Yeah, and we pride ourselves on that, not just from a national level, but also from a local level. And knowing this, allows us to stay focused on fighting for public health and advocating, as Jenny touched on, for all kidney patients. Some of the programs that we do in the community from the funds raised are our NKF Cares Patient Helpline and our NKF Peers Mentoring Program. Also, we give away grants to fellows that want to go into the nephrology world and study. They're called Young Investigator Grants and much more. And here in Pittsburgh is unique because we're blessed to have a great partnership with the state of Pennsylvania to be able to offer a state-funded transportation program that assists patients with their transportation costs associated with traveling daily, weekly to clinics for dialysis. So that is very unique here in Pittsburgh.
How many people are affected? About 37 million?
37 million Americans, so that's roughly 1 in 7 adults. Nationally.
Many don't even know that they
Right,
have
you
it
were
yet.
saying, you talked earlier. And
There's
the cost
yeah.
for testing is very cheap, isn't it?
It's very cheap to get the test at your PCP, but it ends up costing our government $41 billion a year to support kidney patients nationally.
Wow.
So the average dialysis patient, it costs,
It changes.
It changes
roughly
it goes up every year.
$86,000 per patient
A year.
a year is what we're looking at.
Mm-hmm. And to get tested, is it just $8 or something?
Yeah, it's about an $8 urine test for one of the tests, and really we're trying to educate PCPs to do these tests so that we can catch it earlier, because what we're finding is people literally crash into dialysis. They just feel like they have a cold, they feel run down, and then before they know it, they're in the doctor and they're being told they're in a stage of kidney disease and they're being put on dialysis. When there were preventative measures they could have taken, well in advance, that would have helped them, so much. So really, we do a lot of education with our medical personnel also.
And awareness is key. Awareness is, and that's a pillar of our mission, awareness, prevention, treatment. And as Jenny was talking about the tests, especially if you have a risk factor, and I know we haven't touched on the risk factor, but the risk factors are high blood pressure, diabetes, and family history of either. So mother, father, brother, sister, they have it, you should be asking. And it's getting that message out that if you have those risk factors, oftentimes PCPs and your doctor, they will not, unless you need to be your own health advocate.
Yes.
And that's what is important, whatever disease you may suffer from. And that is our key message, is to be your own advocate and to know, okay, if I have one of these risk factors, when I go for my annual appointment, check me. Can I have the urine test, which again is so cheap. It's so cheap. And basically what that urine test will tell us is it estimates the amount of type of protein, which is albumin, that you excrete in your urine. And protein, you do not want to spill protein. So that is, if they find it, that's one key component to identifying, and then obviously preventing moving forward.
Your family history also.
And then there's ethnic, right?
Yes.
Based on being Asian or...
So minority populations, yes, they have high rates of diabetes or high blood pressure, and such as African Americans, Hispanics, Asians, Pacific Islanders, and also Native Americans. And so knowing that this disease runs rampant in those ethnicities, that in itself also is important to know and to ask. And
we do a Keep Healthy screening. That's one of the services we provide to our local community, that we use the money we raise to put those on, and we try to do them in underserved areas or places where we know there are, people are hit hard by this disease.
It's important. I think education is important, getting the facts. We live in fear, or we don't want to deal with it, but getting just a quick checkup to find out, and it's inexpensive, and it can create prevention versus all of these other issues that we face,
We're trying to turn from, kidney disease to kidney health.
Yeah.
That is like our CEO of the NKF, he's a kidney patient, a transplant recipient, and he's working very hard to trickle that message down so that we could make that transformation from disease to health.
So, can you just give your website again?
Yeah, well, our national website is nkf.
is kidney.org.
Kidney.org.
Yeah,
but our
local website is kidneyall.org.
You can find all of our local events and ways to get involved, ways to volunteer.
You have 4 events that come up, right, through the year. You mentioned some, but there are 4.
Yeah. We just finished Monopoly, our corporate Monopoly tournament, and that was at Rivers Casino.
I love Monopoly.
It is such a fun event. This is a win for everybody, because even if you don't have a connection to the disease, you get to come out. You get to be a part of a 4-person team. You network with all kinds of business leaders.
I love Monopoly, though. I'm obsessed with it.
Oh, it's so fun. It's a blast from the past. We have bankers. They wear the visors, and it's just really fun. So you give back to a great charity. You learn more about kidney disease, but you also have a chance to network and just have a fun night. And then we have our upcoming walk, our kidney walk.
Yes.
It's at the Pittsburgh Zoo on November 3rd. And it's really a day of celebration. We have, people who have had transplants, people who are in a stage of kidney disease who are looking for a living donor. We have many walkers from dialysis units, from medical centers. It's just a great day. We attract about 2,500 people. We have a lot of great entertainment for kids, face painters and princesses, and it's really a leisurely walk through the zoo. So, and it's just, everyone wears a themed t-shirt, and it's a great day.
I've heard, and I have friends of mine who are part of that walk, and I